You're listening to Pueblo y Salud's Platicando y Mejorando, an inspiring program that promotes the health and well-being of our community through intellectual, physical, economical, political, and spiritual discussions with experts and leaders in these fields. Están escuchando Platicando y Mejorando, un programa inspirador que promueve la salud y el bienestar de nuestra comunidad a través de discusiones de lo intelectual, físico, económico, político y espiritual con expertos y líderes en estos campos.
Welcome, this is Platicando Mejorando. This is Sandy Logan with KROJ 101.5 FM. I'm here with a special young lady. We're going to be talking about Out Against Big Tobacco, a Los Angeles program right here in LA. So we're going to get started and figure out how we can help, what's going on, how does this impact multiple communities. But let me just get started. Jessica can help us understand all of this. Jessica, thank you for being here.
Thank you so much, Sandy. My name is Jessica Esquivel. My pronouns are she, her, and I work for the California LGBTQ Health and Human Services Network, where I oversee the Out Against Big Tobacco Los Angeles program.
So tell me a little bit about what you do in your organization.
So in my organization, I do a lot of things. I oversee mostly the Out Against Big Tobacco Los Angeles program. However, we do work in health equity. So we're doing a lot of work for the community in terms of their health, their well-being, providing that health access, really just accessibility, affordability, trying to get a lot of things moving, even the political sphere. So just really uplifting and supporting our community in areas that they're not really getting the help or sufficient help in comparison to a lot of other communities and just, people in general.
Tell me a little bit about you before we get started.
Yeah, so I'm originally from Arvin, California, shout out, but I was born in Bakersfield, where I spend a lot of my time still, but both there and in Linwood, California. So another shout out. At heart, I'm a Valley girl, but have grown a huge appreciation for Los Angeles. I mean, we all grew up aspiring to live 20 minutes from the beach, and with LA so close to Bakersfield, it just made sense to make that a reality if I ever could, and I did.
That sounds awesome. So let's dive into this. I need to know a little bit more about Out Against Big Tobacco, this Los Angeles program right here. Let's talk a little bit about, I'm looking at the titles, I'm looking at all the acronyms. What exactly do all of the letters represent?
Yeah, so I can just go ahead and start off with the acronym LGBTQ. It encompasses the various identities across genders and sexual orientations. The acronym is often used to refer to this community as a whole. Other variations of LGBTQ plus includes LGBT, LGBTQIA plus, and there's just a bunch of others. They all serve to include individuals who identify as queer, questioning, intersex, asexual, and a lot more. And then another title, I guess, or name that I want to point out is California LGBTQ Health and Human Services Network. So that's where I work, and that we're commonly referred to as a network because I know it can be a mouthful. And we're an organization dedicated to health advocacy. Like I was saying earlier, we bring together over 60 nonprofit providers, community centers, and researchers to promote and support state-level policies and resources that will ultimately advance the health of LGBTQ plus persons.
So can you name a couple of different ways that you support these communities?
Yeah, so I'll go ahead and mention 3 specific ways that we do that. We expand coverage and improve access to quality healthcare. We strengthen programs and build capacity for other member organizations. And we increase funding to LGBTQ health and human services organizations. And we do this typically through regional funding sources, state level, and even federally.
What are some of the projects that you're currently working on?
So right now we have 4 specific projects that we're working on. The first is Out for Mental Health, which is a statewide project that advances mental health equity, provides resources to local LGBTQ plus communities, and represents a coalition voice at the state level, for policy discussions and just really getting that policy work done. Secondly is We Breathe. So that's a statewide coordinating center to reduce LGBTQ tobacco-related disparities. Third is our LGBTQ Mental Health and Safety Initiative. This is actually our newest one. Which provides supplemental support to different organizations to improve security measures at organizations and mitigate risks as they occur. And then lastly, which is my program, Out Against Big Tobacco. Some of the other projects I just mentioned, my project is more regionally focused. So it serves coalition members, which consists of LGBTQ plus individuals and community organizations that work together to address tobacco control and health and equity issues.
Does your program specifically work in do you cover the entire Los Angeles County or a specific spot?
Yeah, so we have two specific focus areas, and that is in San Fernando, as well as Signal Hill.
Nice. Well, that's right in my backyard. So we're going to continue talking. Tell me why bringing awareness to this particular intersection between LGBTQ plus identities and tobacco. What's the connection?
Yeah, so while Los Angeles County has a wide range of tobacco control resources and cessation programs, none are dedicated specifically to the LGBTQ plus community. So while we don't specifically specialize in cessation programs, we do offer a lot of, like I said, tobacco control resources. So that was one of the that's why one of the goals of the Out Against Big Tobacco program is to empower LGBTQ plus community members and organizations to just really help them engage in tobacco control work. So we work with organizations like the LA LGBTQ Chamber of Commerce, American Heart Association, Equality California, Somos Familia Valle, Trans Can Work. So those are just some of the ones that we work with. And again, like we work collectively to build on this tobacco control work because a lot of it isn't being done for our community.
Well, I gotta take a quick music break. I'm gonna be right back. Don't go away. Welcome back. This is Platicando Mejorando, KROJ 101.5 FM. So help me understand, is the LGBTQ community being targeted with smoking? Is this what's going on? Is this why we're looking at more educational programs for this community?
Yeah. So one thing I think people don't really realize is that LGBTQ plus, specifically people of color and the transgender community, especially face increased rates of smoking and worsened health outcomes compared to the larger LGBTQ plus community, as well as the population as a whole. So by providing subcontracts to organizations, which is something that we do, get these hard to reach parts of the LGBTQ plus population, we ensure that we are reaching the most vulnerable parts of our community.
So let's see here. You brought up tobacco-related health disparity, and few times now, what are some of the examples of this? Can you share some examples of how this works or how people are being impacted?
Yeah, so across the county and the state, the LGBTQ plus community suffers from significantly higher rates of smoking than their non-LGBTQ plus counterparts. Statewide, 5.9% of people identify as smokers, while 10.4% of lesbian, gay, and bisexual individuals and 15.2% of transgender and gender nonconforming people identify as smokers. So these are just examples of disparities, as they're especially stark in regions of Los Angeles County with high rates of LGBTQ plus individuals. So essentially, the LGBTQ plus community displays tobacco-related health disparities in three major areas. And that's that LGBTQ plus people experience a health burden from commercial tobacco, unfair and unjust practices harm LGBTQ plus people and drive these disparities. And then lastly, LGBTQ people encounter barriers to quitting successfully. And that is because we are targeted, or were for many, many years, and to this day, even by big tobacco, the big tobacco industry.
So can you give me a few examples on how tobacco is impacting these communities?
Yeah, so I'm gonna kind of start off with the decades of targeted tobacco marketing. So in 1995, there was a thing called Project Scum, which is essentially Project Subculture Urban Marketing. It was outlined as a predatory marketing scheme to target the LGBTQ plus and homeless communities in San Francisco. So as far back as the early 1990s, we're seeing a huge influx, essentially propaganda, right? Going specifically targeting LGBTQ plus people because they're depicting or displaying pictures that kind of represent our people and our community. And so that was something that, while it looks good and it looks like a normalized way of living, they're essentially highlighting that tobacco use. And so that's kind of something that has been really intricate in our community. And we're essentially trying to break that down, right? We're trying to break that association of the LGBTQ plus community where it's just so normalized to have any kind of, substance use or tobacco use.
Well, thank you for sharing that. Now, with your organization, LA County is so huge, and I know you got two specific cities that you're working on. How are you connecting with these community members?
Yeah, so one way that we do that, or actually we kind of do that in many ways. One of the reasons why we kind of was tasked with this work was because we first want to build on the Out Against Big Tobacco program, which was actually founded by Equality California. We attend a lot of special events. So we'll do a lot of pride events. We go to as many organizations that are trying to uplift and support our community already. So we'll do, just kind of like bringing awareness, essentially, is what we're doing. I mean, we already strive to uplift the lives of folks in our community through health and health access. So this was just kind of another opportunity for us to expand on those efforts. And, we do a lot of trainings and we do webinars, and we just try to really reach where we can and where we're, invited to go. So a lot of our, organizations, or like, I guess just organizations that we work with, they are always inviting us so that we're able to speak on these things. We really try to talk to the youth, since this is, things like this start early. So this is something that, again, just any way that we can, really, to just get the word out.
Well, all sound like great ways to connect with the community. So is tobacco use really that prevalent as you claim it to be?
According to the Centers for Disease Control and Prevention, so the CDC, right? Cigarette smoking is the leading cause of preventable deaths in the United States, accounting for 1 in every 5 deaths. I don't think we understand the magnitude of that. So cigarette smoking accounts for approximately 90% of all lung cancer deaths and 80% of all deaths from chronic obstructive pulmonary disease, and increases an individual's risk of coronary heart disease, stroke, cardiovascular disease, multiple types of cancer, and chronic bronchitis. So these are just some of the things, that essentially smoking leads to. So yes, it is absolutely as prevalent as anti-big tobacco users say. But I do want to emphasize our push against commercialized tobacco and not tobacco for sacred use, especially amongst the Indigenous communities. I know that was something that we wanted to highlight in our work, addressing that very distinct matter.
Well, thank you. Now, would you say that smoking is normalized in many communities, not just the LGBTQ plus communities?
Yes, so I'm Hispanic, and while I come from a pretty non-traditional Hispanic household where my mom was the main breadwinner and my dad did a lot of the day-to-day things, I think my extended family made it so normal to even want to do things like that, i.e. Use tobacco, smoke cigarettes, and today we see it a lot in friends, right? So vapes and hookah are all ways to decompress, when really we should actually be taking the time to think about what would genuinely make us feel better. Is that possible? Is it feasible? If it is, great. If not, let's learn about it, right? Like I mentioned earlier. But even more on an individual level, so like reading, research, work, and the community. We're ultimately working to make our community healthy on all intersex. I might be Hispanic, but I'm also pansexual. And so my intersex meet in a very familiar place, being that we are used to reducing our troubles to a substance, and that's not okay anymore.
Well, thank you for sharing that. I need to take a quick music break. I'm going to be right back. Welcome back. This is Platicando Mejorando, KROJ 101.5 FM. Jessica, you brought up some really valid points, and I'm so interested in this topic. And especially, I hear we serve the city of San Fernando. I really want to know how we can help and how we can connect. So can you tell us some of the strategies that you'll be using for here in the city of San Fernando and communities alike?
Yeah, so the aim is to bring individuals and organizations outside of traditional public health circles who have our common interests and goals together to work through issues, engage in decision-making processes with our project, build solidarity and trust amongst people, and build skills and leaders in the group. A group like this can tackle many problems successfully, especially, like I said, like as a group, as opposed to, trying to tackle the work, trying to tackle big tobacco on your own. Like movement building, right? It focuses on supporting communities to find their own path and build their own skills to address a cause or an injustice, which is, the tobacco use. In this case, we will work together with partners to expose the tobacco industry's continued manipulative and predatory tobacco marketing tactics, just to really help and garner support from these communities to end the tobacco epidemic.
So, some of the things that I'm thinking about just off the top of our head is, healthcare insurance. Have you targeted any of the healthcare providers and see how you can reach these communities?
Yeah, so just kind of putting it out there, like one thing that I don't think we're aware of is that only 15 states have Medicaid programs that fully cover tobacco cessation, which is, quitting tobacco, right? So there's only very few services for all enrollees of traditional Medicaid. So one way that we do expand that is through the coalition. So the coalition itself, like I said earlier, has coalition members from different types of organizations, and they work as a policy driver. So they kind of create policies to bring to Sacramento, and essentially try to get those passed. So we like to get our input and feedback from the coalition members to really address what their specific communities need in order to provide those programs, right? To get those, I guess, provided through, whether it be free health insurance, not free health insurance, but, through Medicaid or Medicare. And yeah, so that's kind of like the way that we do work. We just really guide that coalition so that it's able to work up to Sacramento.
So Jessica, can you tell me, how about California? Is California one of those states?
Yeah, so California is one of those states. And we also work with specific organizations that provide this kind of work that help enter these cessation programs. But we work with Kick It California, which is a telephone, text app, and chat-based tobacco cessation program. These services are free, evidence-based, and offered in a lot of languages. And our We Breathe program, which is also a tobacco control related program, they work very closely with them. So yeah, there's definitely resources here in California, and California is one of those states.
So Jessica, now that we have our audience listening to this, how about if they're not part of the LGBT community, are they able to participate in your services?
Yeah, so while we don't offer necessarily cessation services, we are obviously promoting the tobacco control work, but it's kind of like a misconception to think that because we're an LGBTQ plus organization that we don't support the community in its entirety, right? We support all kinds of people. And I think what we forget is that, even though you're not LGBTQ plus, that is just another part of somebody's identity. So if you are, for example, I'm Hispanic, but I'm also LGBTQ plus. So we are also, we understand that a lot of Los Angeles County is, for example, has a lot of Hispanic people. So it's kind of just trying to help everybody really. But we do have, that specific knowledge surrounding LGBTQ plus people.
I love it. I love it. It's full circle. And I love the way you identify it as it's just a part of your identity. So everybody gets services, everybody's available. It's just a part of how to identify who you are and what makes you special, right?
Yes. Exactly.
So let's see here. Let's talk a little bit more about, sharing health messages that fully represent and capture the LGBTQ plus people and their experiences.
Yeah, so there's a couple of ways that we kind of really tailor our services and our just support in general. And it's kind of we're wanting to increase access to culturally tailored services. So when it comes to health issues, one size does not fit all. Different people and communities have varying needs and make decisions in different ways. For example, some LGBTQ plus people may think of smoking as a way of rebelling against traditional gender roles. Tailored cessation resources and improved access to these resources could be helpful, including acknowledgement that some experiences and stressors associated with smoking may be unique for LGBTQ plus people. And ultimately, sharing health messages that fully represent and capture LGBTQ plus people and their experiences, right? So you were saying, so mass media campaigns are proven to increase smoking cessation, prevent tobacco use initiation, and reduce the prevalence of tobacco use. However, anti-smoking messages rarely appear in media designed for LGBTQ plus people. So that's kind of another way, is just to really capture that, that's that pop culture, I guess, level. Kind of I guess what Big Tobacco tried to do, right? They tried to display images of LGBTQ plus people, but now it's kind of we want to kind of flip side that. We want to make sure that those messages are also, conveying LGBTQ plus people, but in a way that's promoting our healthy lives, not for tobacco use.
I love that. Exactly. This is exactly what we need. These big marketing, I know these industries have a ton of money and are able to promote and tailor their campaigns to a specific group of individuals. But it's important for us to be able to counter those offers, counter that messaging, to show them not everybody is smoking. And just because you are LGBTQ plus does not mean that you need to be smoking. It's not just part of the equation that makes you special. Exactly. That's not part of it, right? So yeah. I love that. We need to do a lot of more counter ads against all of these substances. I worked here with Pueblo y Salud, and we did a lot of the work for MUH, secondhand smoke and multi-unit housing, and really just focusing with the community at large. We went and knocked on doors, and we created postcards, and we would ask them if they wanted their building to be smoke-free. And they said yes, no, the majority of them all said yes. And because it's such a small community, the other thing that we thought was really interesting was that they had no openings in their building. And they're like, well, nobody smokes here. I say, okay, but if that unit becomes available, would you want a smoker next to you? And they're like, oh, no, we don't. Well, I guess then we need to sign the little postcard and let city council know that this is what you want. So we're going to help you because we were doing this in the middle of COVID, which was really hard to get community input. But going to them while they were home on lockdown and not also, which was really important, we were trying to protect their lungs because of COVID. And now we're trying to protect their lungs from tobacco smoke, secondhand smoke. So they both worked really well together. And that's how we decided to come up with this campaign, is just go to them, knock on those doors, and then bring the cards, the postcards to city council to represent them. And then we were able to convince some individuals to come out and share their statements, either by video or by calling in, or even going to city council to help share that why it's important for them to stay in a smoke-free home.
Yeah, I don't think people realize the power of testimonials, which is, it sounds like exactly what you were talking about. So yeah, that's definitely something that we really try to put in our messaging as well. Our communications, our comms girl is great. Shout out Ari. But yeah, so I appreciate you saying that and talking about that, because I think that's also very important tobacco control work.
Well, I think people, like you said, people don't realize we are used to complaining. So we'll go on social media and complain about it. We'll go on to these, next door, these little social media platforms, and people will go and complain about something, but they're not complaining to the right people. And they think because they put it out in the universe, that's going to get taken care of, but they're not everybody's going to find it. So it's important to tailor that information, even if it's just taking 3 minutes, going onto your city council website and just sending them a message. I don't agree with this. I don't like this, or I do like this, and I want this. And then send it off. So at least your message is going to the right person that can help make that difference. And with you having a coalition, it's important because it helps strengthen that voice. And you all together are coming up against big tobacco and sharing that information with the city council and all of our politicians that can help, tailor those laws. All right, Jessica, we've had so much information, and I'm so excited for all of these parents, these community members that support the LGBT community plus individuals. And again, the main goal here is to make them safe and healthy. We want them to be healthy individuals, to live amazing lives. And we don't want tobacco to be, bombarding their ideas on our individuals, especially our youngsters right now. So how can everybody connect with you right now?
Yeah, thank you so much for that. So we have 2 Instagram pages that I want to mention. The first being Out Against Big Tobacco LA. And then the second one is CA LGBTQ Health. So that stands for like California LGBTQ Health. And then lastly, our webpage, which is CaliforniaLGBTQHealth.org. You can reach me on any of the sites. Through the website, we have a form also for people who are wanting to join the coalition. So we do have a coalition meeting that meet on a quarterly basis. Our last one was in July, but if you're an individual or somebody who, like you said, a parent, a sister, sibling, anybody really is wanting to kind of join in on these coalition meetings to kind of just see what more in depth about what work that we do and that we're trying to do. Our next one will be in October, October 25th from 3 to 5 p.m. Again, if you are kind of just more interested and maybe not rather attend, kind of want to talk to me first, then any of those places will be good.
Well, I think that's fabulous. I think people need to get involved, make sure that we have healthy communities. Overall, everything needs to be just about health and wellness, right? And we don't need any more chemicals in our bodies than we have going on right now. So I appreciate you, Jessica, for being on the show. I'm so excited that you're doing the work. I'm so excited that you are helping our community and Out Against Big Tobacco right here in Los Angeles. This is a local program that is helping our community right here in the city of San Fernando. So reach out to Jessica if you need anything else. Please give me a call if you can't get a hold of her. Again, thank you for being on the show.
Thank you so much, Sandy.
And this is Radio Lin, KROJ 101.5 FM. We'll see you next time.